Okay, so after that wonderful talk by Mr. Saurav Roy, we will move on to our next session, which is a very important panel discussion. India has delivered almost 2 billion COVID vaccine doses in the world's largest vaccination drive. The CoWIN application is the digital backbone for the vaccination drive in India. And Covaxin is India's very own made in India COVID vaccine. Now, if both CoWIN and Covaxin are they are not just serving the people of India, but they are serving the people of the world. So what could be more incredible than bringing the two together for a conversation? I now invite Dr. Ram Sevak Sharma, CEO, National Health Authority, and Dr. Krishna Ella, founder and chairman of Bharat Biotech, for an exciting discussion on India's contribution to the world health. This session will be moderated by Dr. Chintan Vaishnav, who is the Mission Director of Atal Innovation Mission Niti Aayog.
Well, good morning, everybody. Good morning, Viva Tech. Good morning, France. Good morning, all the innovators and startups of this nation and the world. Good morning, all the startups of India. This is a conversation, as you know, about India's contribution to the world health. Let me start by talking about some comments that President Macron made on stage one yesterday afternoon at Viva Tech. I must say that I was quite, in some ways, surprised by the way he articulated the problem statement of the healthcare sector of this nation, and to realize how similar that problem statement was to the one that exists in our nation, which is essentially to how to create a healthcare system that's open, that's inclusive, that is economically and otherwise sustainable, and most importantly, one where innovators can play an important role without facing many barriers. This is almost exactly the problem statement that our nation is contending with. In fact, during his comments, I also had from time to time goosebumps, thinking that there were some solutions that we have already arrived at, which could be of use to this nation and to the world. And this is what we are going to talk about in this conversation. We couldn't have a better panel to talk about this with. Here with us are India's two of the most spectacular contributors to this sector, with Dr. Krishna Ella, who's a scientist, entrepreneur, who, somebody gave a very beautiful introduction to him, where they said that in the last 2 years, there have been 4 vaccines in this world that have been successful. He is the father of one of those vaccines called Covaxin. We also have with us a bureaucrat entrepreneur, Dr. R.S. Sharma, Ram Sevak Sharma, who's, as you heard, is the CEO of the National Health Authority. But before that, he was also the chairman of first the UIDAI, the National Identity System that has been in conversation here at Viva Tech over the last 3+ days, and then subsequently chairman of the Telecom Regulatory Authority of India, now the CEO of the National Health Authority, and again somebody who has made a larger-than-life contribution to the challenges of our nation. So I welcome you both to this conversation. Behind, as a backdrop, you may see this is not an animation. This is a real-time view of the vaccination dashboard of India. The numbers that you see, well, yesterday we talked about it, so we won't really go with it, but we thought you should be entertained with some more dynamics while we talk about this important question. I'd first just remind my friends that if you can have your mic touch your chin, then your sound will be the best. Let's get started on this. Let's first articulate the problem. Okay, what is the problem, right? Because every time you talk about healthcare, every person has a different problem formulation in their mind as to what is the healthcare problem. For example, ever since I came to Paris, every time I had a quiet moment to talk to a cab driver or somebody, I asked them, what do you think about healthcare here? And they said, oh, it's great. They take care of you. And then you turn around and ask a policymaker, what do you think about healthcare? And they say, oh, it's terrible. We have lots of problems here. Right? And so I realize that problem formulation is an important thing to do. So let me start with Dr. Ella here. Sir, you have been in this space for a long time, and your view may be one of an inventor, a scientist, a manufacturer of vaccines, and so on. But we want to know how would you characterize the healthcare challenges of India and the globe, the top challenges as you see them?
I mean, the healthcare challenge is not more Indian problem. It's going to be global problem. Anything appears in India will appear in France, will appear in US, and vice versa. I think it's, the pandemic has taught us a simple thing, that with the global travel and all that, nobody can escape from the world. So that's a major challenge. And also the important second challenge is most of the neglected disease turns into pandemic. And all the neglected disease only present in Asia and Africa. And we don't control there. The entire Europe also will not be controlled. So I think the source of place is Asia and Africa. I think both globally, everybody should work together to interest of the US and France, everybody, in the interest of India also. It has to be global health now, not anymore Indian problem or a French problem, nothing like that. It's global problem. That's what I see as a changed scenario of the globe.
Yes, thank you. Dr. Sharma, how would you characterize?
Well, I think it's a very important question, and I also believe that, when you design a solution, many times you design solutions without having a problem. So it's better to really articulate, but of course, it's a difficult question in the sense that it will take a lot of effort and time to fully comprehend the whole issue. But I would say very simply a couple of, maybe a couple of lines. One is, on the supply side, you have the problems relating to hospital. The health infrastructure is not really very, very adequate in our country. Let's admit that. Then on the demand side, the people's, sort of health-seeking behavior, it depends on the kind of class to which you belong to. Poor people will have some problem. They'll say, "ठीक हो जाएगा, थोड़े दिनों में अपने आप ही ठीक हो जाएगा." And while on the other hand, middle class, upper middle class, they have a different kind of issues. But I think from the way I look at it, the most important problem is the problem that when a poor person gets sick or ill and he can't avoid hospitalization, then the kind of expenditure which he is asked to put in, that really throws him into the poverty gutter. So that's a very serious challenge which we have, looking at it from the patient's point of view. So the other related issues could be because of the paucity of hospital infrastructure, distance is a problem. Then of course the quack is a problem in our country. So there are multiple dimensions to this health problem, but I think one of the most important dimension is the dimension of the people getting back into poverty line, because there are suppose somebody has cancer, suppose somebody has some other problem, poor person, then he has to sell his agricultural land, he has to sell whatever cattle or whatever he has got, and that I think is a real human problem. And these are the issues which are craving and crying for solutions. We have provided solutions. They may not be perfect ones, but I think there are solutions which are there currently and which are coming on the horizon, which we will talk a little later.
No, thank you very much. I think, the formulation that health is not a geographical statement. That is an important thing to underscore. And I think, Dr. Sharma, what you are highlighting in terms of the disparity and its manifestation in the way people demand health, people supply health, although all people ought to have equal opportunity to cure themselves. But that also, although it's very starkly evident in our, say, India's context, because the disparity is so stark. Having spent a lot of time in the places like the United States myself, I do know from doctor friends that that same problem exists in very developed places, not in the form of whether you have enough money or not, but in the form of the complexity and the information and the navigating the system. Once you are in the throes of a major disease, it can really make you poorer in many ways. So I think that's an important commonality here to talk about. So let's think about. Well, let's lay it out. What India has done in this healthcare sector realm so far. I'll start with you, Dr. Sharma. If you could please tell us what is the National Health Authority doing to take on the challenges of this sector in India?
See, there are, I think it's not National Health Authority per se, but the entire health sort of ministry and the health administration. So as you know, health is a state subject in our country, and it's a state governments who are supposed to take care of the health issues. But our Prime Minister has basically focused on 4 areas, which are under what is called the Ayushman Bharat umbrella. One is the Ayushman Bharat Health and Wellness Center, which basically seeks to strengthen on the supply side the primary health centers. So that's one part which is very aggressively being done. Another is the Ayushman Bharat PMJY, Pradhan Mantri Jan Arogya Yojana, which essentially takes care of this problem of 40% of India is poor, because they are now provided a 5 lakh rupees insurance cover per year per family for hospitalization, for inpatient kind of things. And that is actually very important intervention which has started just about 3.5 years back. In that period itself, we have done about 40,000 crores. We have done about 3 crore patients, inpatient hospitalizations have happened. And this entire process is paperless process. And this is what we do in the National Health Authority to implement this program across all states. And just to give you some figures, we are actually processing 1 million claims per month. So that's currently the situation. And it's all paperless, basically, and it's also purely, truly public-private partnership, because the private hospitals, we have a panel of about 25,000 hospitals, half of which are private, half of which are government. So that's one intervention. Third intervention is basically Ayushman Bharat Infrastructure Mission, which is basically seeking about 65,000 crores rupees have been provided throughout the country to basically build health infrastructure of a higher order before the health wellness center, much more like medical colleges, other institutions. So that's the third pillar of Ayushman Bharat. The latest and the fourth pillar of Ayushman Bharat is essentially the Ayushman Bharat Digital Mission, which essentially seeks to leverage technology to reduce cost, which is increase affordability, to basically make it ubiquitous, which means that you don't have to, you can provide that health facility in the remotest areas of the country using technology, and to improve quality. So essentially quality, affordability and accessibility, all these 3 problems are going to be addressed through this. The Prime Minister has launched this scheme on 27th of September last year, and now we are providing to each citizen, each person, what is called Ayushman Bharat Health Account Number. where a citizen will have the facility to store his or her health records in a, so that we can have a longitudinal history of his health records. He will be able to share the health records, and all that digital building blocks are being done, keeping in view the scalability, the interoperability, the privacy of the data. So all the, sort of principles of privacy by design, scalability, all these are being addressed. You just now are showing Coven the same principle. We already have 220 million Ayushman Bharat health account numbers in our country. We already have we are creating health facility registry, we are creating health professional registry, we are creating the drug registry, laboratory registry. So all this digital thing is going to really transform the service delivery in the health sector. That's what are the broad 4 areas of intervention which we have undertaken.
So that's fascinating, particularly the digital infrastructure bit, which is again very highlighted here at VivaTech from India, is an area where India is clearly a leader. Could you elaborate a bit on that in terms of, so here's a situation where there is an existing infrastructure of health that has taken care of us so far, and now you are introducing this digital infrastructure, and how is it organized in order for everything to come together? If you could describe to the
that's an excellent question, because typically people do not, sometimes they confuse that a digital stuff is quite different from physical stuff. But this is not the way it is. Actually, digital is making the, the whole thing completely, integrated with the physical. So for example, like the UPI, this is basically, what did UPI do? Just in simple terms, UPI unbundled the payment system from the banking system. In some sense, payment became a separate application altogether and connected the bank. So similarly, we are having what is called UHI, the Unified Health Interface. Now, Unified Health Interface has broadly 3-4, sort of components. One is discover. So essentially, discover the facilities, the laboratories, the blood banks, all ambulances. That's one part. And the second part is essentially book, which means you can, book the slots for COVID, vaccination, or you can book your appointment in a hospital and a laboratory. And third is avail. So basically, you avail the services, pay for the services. And fortunately, because we have actually created the horizontal building blocks like digital identity, digital payment system, consent artifact, digital locker, all kinds of things are there which actually enable all these transactions to happen. So for example, a doctor makes a prescription, and now e-sign is there, which is basically e-signature by demand. When you file income tax returns, you use e-sign provided by on top of Aadhaar. That basically you sign the digital prescription, and that prescription is good for anywhere you can get the medicines. So I think this whole digital and physical is going to create a synergy in such a manner that all the 3 aspects of affordability, accessibility, and quality are going to be addressed. We are very confident that the kind of structures or building blocks which we have made, which actually are scalable, interoperable. Let me also tell you something very interesting. Currently, if you have a video conferencing, a telemedicine teleconsultation, you can do it only on the same platform, which means that if you are on a Practo, you have to have a Practo client application, and you have to have a Practo, doctor application. You are on 1mg, that's what you can do. If you are on eSanjeevani, which is a Government of India application for teleconsultation, the doctor also have to be in eSanjeevani. What we are creating is a completely different paradigm shift, which is interoperability, which means the client can have any application, and the doctor can have any application, and they will be able to talk. And just to give you this, for example, if you are on Amazon, if you want to do some purchasing and selling on Amazon, you have to have an Amazon application on your mobile, and then you can purchase. You can't have a Flipkart and purchase on Amazon. But this is what we are doing. This is essentially based on protocol. So if I am on Rediff Mail and you are on Gmail, I can straight away send mail to you. This happens because of the SMTP protocol. Similarly, we are creating protocol-based systems which will basically ensure that they are completely interoperable. And whosoever gets into the UHI protocol, whosoever follows, they will be able to have interoperability. And I think interoperability is what will going to increase the scale manifold. So that's the overall structure and architecture which we are putting in place.
I think that's beautiful, and I want to underscore a couple of points that you said, largely because there's a lot of fear of unknown here. Well, first thing you said about the phygital, which has nothing to do with fidget spinners, by the way. But think about a problem that is being addressed in traditional fashion in your nation. If you are able to devise a digital carpet that is laid over all of these institutions that are solving the problems, so that they can work with each other to solve the problem better, that kind of a solution, which is a solution entirely in bits. It is not a solution in atoms. This is a solution entirely in bits, not in atoms. This is a solution that was born digital, will remain digital. And oftentimes when you say that, and when people hear the scale, they get fearful that, what is this doing to me? Let me remind you that this is exactly the principle on which the Internet protocol was created in 1973, when Xerox and IBM and DECnet and all of those networks couldn't talk to each other. An IP protocol came and laid a carpet that allowed you to walk over those networks. This is exactly what's happening. The other point that you said about interoperability, fundamental point, I have a question about it. In a nation where the institutions, private and public, are more established and entrenched, in a more developed nation, how do you sell this idea of being interoperable to such established entities? Is it about that your market will be very large? What is it that you tell them?
I think that's again a very important question. What we are saying is, look, interoperability is required because without interoperability, the market will not expand. Let me give you an example. If let's say we have three players in India, Vodafone Idea, and of course Jio and the Airtel. Now, if there was a system where Airtel customer could only talk to Airtel, Vodafone customer would only talk to Vodafone, then even if you have, let's say, 1 billion population divided into 300, the total number of, and each entity had only 300 customers, then the set will be divided in mutually exclusive subsets of 300 million each. Now, when you allow interoperability, then it's a whole set. It's a 1 billion set talking to 1 billion. So the whole interoperability expands the market 10x. And that's how I think and also, it is not as if interoperability will not allow Airtel customer to talk to Airtel. It's not as if their native communication will stop. No. They will be in a win-win situation because now they will be able to get more customers for themselves. So one is increasing the market. Second, democratizing. Third, very important point is, currently the digital space, the way it has developed over the last 25 to 30 years, actually it has promoted monopolies. Today you see there's only one social media platform, there's only one Twitter, there's only one Amazon, couple of fellows. Everybody is just kind of, it's a winner takes all situation, which has happened because of the deliberate, sort of cartelization or deliberate cannibalization of the APIs, which are private, proprietary APIs. Once you develop this interoperability, it's a democratization, and then of course it's going to reduce the entry barriers, it's increasing the competition, it's actually going to provide quality solutions, and it is going to be inclusive above all. So I think these are some of the things, and I don't know, I'm not a salesperson, But I don't see, I don't think anybody should see not being a valuable, this whole proposition of democratizing and making it accessible, inclusive to everybody is actually a win-win for everybody. And it's certainly a win-win for a people of whatever country they are in.
Well, I think you are a salesperson. That was very well said. Well, I do want to say that there is a beautiful juxtaposition in this conversation here because we are having this conversation in France. And if there were any industrial economists in this audience, they would say that we knew this all along as a theorist. What is important about what you are saying is that we have been able to navigate the political economy of the market in order to put it in practice. This is particularly important juxtaposition here because Jean Tirole and Pierre Lafon, well, Tirole won the Nobel Prize for Industrial Economics and lives in France. And so on. So that's beautiful. Let's move on and let's talk about CoWIN. Yesterday we had a brilliant exposition of CoWIN, how we were able to do this with such a scale and speed. We're not going to repeat all of that, but I want to ask two very important questions to our panelists, which is where they have made an important contribution. The first one to Dr. Ella. Dr. Ella, you have been a proponent of building traditional vaccine. That is what you built. You have not been a proponent of mRNA-based vaccine, which a lot of other people built. What is important about your approach? Why did you take that approach?
I think it's a very interesting question. You know, we don't have a liability. We have a liability problem in India. The vaccine has got three important components: safety, safety, safety. If you don't have safety, I mean, you can't harm a person. And a healthy person, we are giving it to healthy people. When you are giving healthy people, if anything damages, it's more dangerous. And also the nice thing about US and Europe, they don't have a liability on insurance. If the given a vaccination is given, nobody can sue the company in US or UK or Europe. They can't sue the vaccine companies. Whereas in India, we can be sued. Even the smallest adverse reaction, they can sue us. And I have a lot of cases on adverse reaction. So I think the different system. And the mRNA vaccine is a good platform, scalable. We are also possible to do it for us. We are doing it. But we are looking at the safety pattern of that vaccine, where it leads to. But we looked at the inactivated vaccine. I think we want to have our citizen to be the safest vaccine. That was my dream. And what is important is we need a BSL-3 containment, and we are the only one in the world had a BSL-3 containment production facility. That added value to us. The facility came in picture so that, you know, we can put the old technology back in the place and manufacture and produce the safest vaccine. And I think today, I'm happy to say, we have more than 23 publications on Covaxin. And all seven Lancet articles and 2 Nature articles. Okay, all, you know, shown to the world that even an inactivated vaccine produce the best durability. And the only thing problem in India is everybody looks at diagnostically look at IgG response. They should not look at IgG for the Covaxin. They should look at T cell response. A child is given 3 doses vaccine. It's a lifetime immunity. And that's a concept we built in this vaccine using an adjuvant, shifting from IgG to T cell response, a memory. And that is what the differentiation for us, whereas other vaccines are not producing more T cell. And we are the only one producing highest T cell response. That came out Nature Microbiology just about a week ago, a publication. So I think we produce the safety important, and we are working in a system where the legal liability is there, existing in a society, where government doesn't give any protection for us, a vaccine company. If the government gives a protection, liability issues, and I think we can take a risk, and we can move forward, very advanced technologies. So that is holding us because of the liability issues. Thank you.
Well, it's again,
I just want to say, Chintan,
yes.
You said Sharma Saab is a salesman. He's not a salesman, he's a visionary. And I'm telling you, had he started a company, you would have been a unicorn long back.
Oh, yes, I believe that. No, I didn't mean it in a negative sense, of course. But I want to I want to touch upon one part of your story, Dr. Ella, which I find very fascinating, as to how you arrived at this insight of taking this pathway to drug development, being an agriculturist. Could you share that with people, because that's a very deep interdisciplinary insight. Yeah.
I mean, I'm an agriculture graduate. I don't know anything about vaccine, honestly. What in US, I did yeast molecular biology, domain knowledge, where gene knockout, gene taken out. Gene taken, I can take out the gene out and I can put the gene. That one domain knowledge helped me to make a hepatitis B vaccine. Hepatitis vaccine is produced in yeast, and you put the gene, put back, and you get the product out, yeast. That one domain knowledge what made me a startup in 97. There was no startup concept in 97. We are another company, okay? And I think we have to pledge your shirt and pant for the bank loan. Everything. Today you're all kids, I think you're lucky. You're all, a lot of grants are coming to all of you. I think you're in a lucky time. And Niti Aayog gives you flight ticket to come to you. Nobody used to bother us for that time, 97. And I think, in a different world. And I think we were worked in a startup as a startup, looking at the passion for, I always believe only one thing. You solve a society problem, you'll make money. But you go behind money, you will never make money. So keep in mind that solve the society problem. You'll automatically, the money is a secondary part of it, and it will come automatically. But don't give a startup important advice, don't go behind money. Always, if people are worried about mobilizing money, but don't look like that. Solve the society, and I think you'll all succeed. And I think you are a great entrepreneurs, great startups today. I think Chandan is there to guide all of you, and I think I wish all the best. That's how my journey was.
Well,
and I have 10 companies now. All 10 companies are different speed, different aspect of it.
Well, thank you very much. I think it's a great fortune for our nation to have a visionary like you as well. And what I find fascinating about this story is that if you go back to the fundamentals of any problem solving, everything is the same. It does not really matter you are an agriculture graduate or a biology graduate or whatever. I think that's a very, very key insight that for interdisciplinarity that's underappreciated. One question for you with this COVID backdrop here. In initiative after initiative that you have been involved in since UIDAI, there has been a fundamental institutional innovation in the government in order to deliver such solutions. What is that innovation, and how can other nations attempt something similar?
I think that's again a very, very important question, because what is happening is when you work in the government, then you have certain sets of procedures, and normally that work is not innovative, I would say. It's a regulatory, typically it's a regulatory, it's basically maintenance, it's doing certain things in a certain manner. Of course, there are, examples like if we are working in education, health, then you are giving money or you are, sort of promoting certain things. But if you are doing a project like this, what is important is to ensure that you have, private sector versus public sector. Let me just, broadly the stereotypes which are there, and of course these are true to some extent. One is private sector has the agility. They have the agility, they can change, they can repurpose themselves. Government has that scalability. The whole population scale, we think scale. So, and on the other hand, you have the government has that kind of, we are spending public money, it's not my money, so therefore you also have certain processes and procedures. Typically, people just confuse the processes with the end objective. And that most bureaucrats, end up thinking that the process is more important. What is end objectives, they forget many times. What is important is to have a structure which actually combines the agility of the private sector the innovative approach of the private sector and the other, good things of the public sector. And I think common aspect which you will find, the people from iSpirit are there, and there are many people involved. In Aadhaar, for example, we had Nandan Nilekani, who was the, from the private sector. I was there as the CEO of that organization from the public sector. And we created an organization which is actually truly public-private partnership. We had a lot of, very bright boys and girls, and we provided them market salary. At that point in time, 2009, we provided them 32 lakhs per annum. It's not, today it's peanuts. But at that time, 32 lakhs, 13 years back, was quite a substantial amount, and we were paying from the government exchequer, please believe me. And everybody would have questioned, whoa, why have you hired such people when my salary itself was about 50,000 rupees? And how are you paying that fellow 3 lakh rupees per month? So this is, but we said no. They bring with them certain talent which we don't have. But another way is to outsource. But you can't outsource thinking. You can outsource certain functions, but not thinking. So therefore, I think what is required is an organizational structure which you should create for every such project, which is a mission mode project, where you should draw upon the talent of the private sector, some inside your organization, some outside as service providers, and you should have the public sector guys, and let it happen. And that is how UPI happened. That is how Aadhaar happened. Of course, CoWIN also happened, but CoWIN is a relatively smaller, just one software which uses many of these principles of, Aadhaar and UPI, which we learned, principles of interoperability, inclusion, frugality, ease of entry, these kinds of things which learn. So that these are learnings which we have put in place, and I think these common learnings must be used all across the systems. But it is important that you have a focused organization, and that can be created in the government structure. After all, what you are doing, Chintan, is such a wonderful work. We've been interacting with you, and I've been talking to you. You are really putting in place what kind of innovations can be put in various systems. But then what is important is that the owners of those systems must actually accept your suggestions. Many times in government, we don't accept the suggestions unless the person who is giving suggestion has some authority in doing that. So sometimes these voluntary type of things work, sometimes they don't work. That depends on the leadership and the department. But that's how I think it should happen, happen in a public-private partnership manner where we utilize the best of both worlds.
Well, that's a very profoundly important point, and also something that I see in my own conversations as as the piece of the puzzle that many nations struggle with. Technology is easier to come by, but the institutional innovation is much harder. So thank you for sharing that.
One thing,
please,
if I can interrupt.
Please, yeah.
See, one more important part is political support. It's extremely important. We may do technology, we may do all kinds of bureaucrats do everything. But believe me, unless there is a political support for an idea, for something, it will not happen. The Prime Minister of India has been so absolutely positive in this whole issue. Aadhaar, for example, the BJP was saying, though, we will not do it. And then the new government came, and then, of course, he adopted Aadhaar, and then he has gone whole hog. In fact, the kind of applications, direct benefit transfers, we are having 2 billion transactions per annum, even in LPG cylinders, 50 rupees, 40 rupees. Imagine this kind of technology application which has happened. But this has happened only because of a top leadership support. So I think that's the most critical part of it.
That's fantastic. Yes, I think you are an engineer, so am I. Dr. Ella is a scientist. Let me articulate what you have said just now as the following equation, that large-scale impact is a function of political support multiplied by bureaucratic efficiency multiplied by private enterprise, and it's the sign between them is multiplication, because if any of them is zero, the output is zero, right? Okay. So let's end in the last 2-3 minutes that we have with making a pitch, because all of these young people are used to hearing pitches and making pitches and so on. And this is a pitch about what can India do for the world healthcare. Dr. Ella, you have often expressed this vision that India is not about generics, it's not about digital only, it's a product nation. It's not that we can't manufacture in India. I mean, there are no such barriers. So open us up to what India is to the world, please, as a pitch.
I mean, India can innovate, but the problem is the global perception is India cannot innovate. India is only a generic country. I think as a vaccine company, as a startup in '97, that was strong in my mind that India has to change. We need to go to value addition in a different angle. And I think I'm at least happy to say typhoid conjugate vaccine, first vaccine in the world. When we did and approved in India, even Gates Foundation was not believing that this vaccine will work. They said, we want to have a human challenge studies in Oxford. We said, we'll go for it. And they funded the project. We did a human challenge studies in Oxford. We got 89% efficacy. Human. And then they said, will it work in the field? The question people are asking Indian vaccine, how do you really prove it? Really it works. So then they said, we want to vaccinate the children in 6 different countries. Bangladesh, Nepal, Malawi, Burkina Faso, and Ghana, and Pakistan. All these countries have been vaccination covered. Almost 7 lakh children were vaccinated and shown almost 90% effective vaccine. Now it's a WHO pre-qualified, we are supplying to Africa, all that. That was the first molecule. Even multinationals have not done it. Even US has not done it. First molecule from the globe. So we've done that. Now we are doing a lot of things like Zika. We are the first company to file a global patent. Why we filed a global patent? Western world should know that we are the first one made it. Otherwise they won't believe it. India cannot do it. So I think we have done even Brazil incident. 1 year before the Brazil incident, we filed a patent. So we are able to predict Zika will come. And we had a chikungunya, again first vaccine in the world. Right now phase 3 efficacy is going on 6 different countries thanks to CEPI funding, and it's going on different countries trial. Again chikungunya will be the first one. Zika will be the first one in the world, not just in India. So I don't consider anything in India is an innovation. For me, the global point. And then NTS, non-typhoidal salmonella, it's a major problem in Africa. And it's mostly Eastern and Western Africa. It's a major problem. And we are working with the Wellcome Trust and University of Maryland. We've done a phase 1 in Baltimore already. So that will be going to for Africa again. So we partnered with GSK for malarial vaccine. And there's only malarial vaccine in the world. And that malarial vaccine is going to be manufactured in India. So I think we have a cholera vaccine. Again, a major problem in Africa and India. And again, we have partnered with the Hillman Lab, and we are in the phase 3 trial. So what I'm trying to say is, it can be done. Innovation can be done. And it has to be done. We want to be respected as a country. And as a scientist, we need a respect. We need to create innovation. You're doing one more reverse engineering will not help us as a country. Thank you.
Dr. Sharma, thoughts on this? Yeah.
No, actually, I think what India can do for the health to the world, I think Dr. Ella has already, given one aspect to it. One facet of that has been answered by him. I will say, that among many other things, one thing which India can do, and this will be hugely transformational, is essentially share the digital public goods which India has made with the world. Let me share with you that as a telecom regulator and before that as the Secretary of Electronics and IT in the Government of India, I have had the occasion to travel and then see what kind of products on various facets are being developed in various countries in the world. And it is very politically incorrect to really, tell them that what you are doing is something very, very roundabout, something very, very, primitive, non-interoperable. Don't do this. But then, some consultants, some companies are telling them this is how you do. So, for example, identity. Now some telecom companies are providing identity solutions. Facebook is providing identity solutions to many countries. Now this is what is happening. Everybody wants to figure out, and these are absolutely primitive, roundabout ways of really doing something which is not really desirable at this point in time, especially when you have the ubiquitous connectivity in the world. I know there are places still in the world where data is very costly, where connectivity is not there, but I think largely things are changing. 4G is coming, of course, everywhere. Then, of course, 5G is also, has happened in many countries, and it will come. With that kind of connectivity being there, and the architecture which India has developed in spaces of identity, in a space of payment, in terms of developing multiple products which we have developed now, digital health, for example. We are developing other sectors also. We are digital commerce, for example. Now we have in India a project called Open Network for Digital Commerce, which ONDC, and I can tell you it's again going to be as transformational in the digital commerce space. And people may not be talking about it today, because today you have such dominant players in the market which are trillions and trillions of dollars, and we are just a startup. But I think things are going to change, because the basic philosophy is a network philosophy. It's not a proper, API type of philosophy. The proprietary philosophy is not there. It's a network philosophy, which basically means that we are building internet on top of the internet. Why internet has not been able to be owned by anybody? Of course, companies tried. Facebook tried with free basics. And they tried in India also. We did not allow them to come. We have net neutrality, which basically Europe is also having the net neutrality. And the whole concept is internet must remain a permissionless platform for innovators to innovate. We should not run around the telecom operators to become the gatekeepers of internet. No. So that's the openness philosophy which we have followed. And these are some of the lessons which I think India can tell the world. What you need is essentially some kind of articulation to those people, and ensuring that we should become a trusted partners. We don't have any agenda. Our Prime Minister says India is a Vishwa Guru, and when you said Guru is not asking anything from Chela. Guru is not really asking, except probably some nominal and symbolic Guru Dachana once in a while. But we are not asking anything. And we may not have the money, but we have the knowledge. And I think we must share that knowledge with the world. And that's the whole, in whether it's a space or any other sector, I think we must do that, because our construction of that knowledge by very nature is open and non-proprietary and free. That's what is important.
That is very passionately said. Thank you so much. And it reminds me of this early quote from one of the internet pioneers when the internet was being invented, who said that we don't believe in kings and kingdoms. We believe in rough consensus and a working code. So you have, we have delivered on that. Let me once again say, for us, for India, healthcare innovation is not a geographical statement. For us, innovation is not a geographical statement. We are here to solve the world's problems. Believe it, and we're coming. Thank you very much. Let's say thank you to these two individuals who have saved many lives, and the evidence is right behind them. Thank you.
के बाद वो मेरे को 3 बार आके बोला है